It's hard to describe her. You know, she's the most delightful child. She's beautiful, bubbly, and I very rarely saw her upset or crying. She's always a very happy child. And
Sarah just kind of noticed that she was just not really acting herself. So we took her to the pediatrician that afternoon, and we were sent up here kind of as a precaution and just to make sure and rule some things out. And I didn't think that we'd be staying up here. I figured we would have turned back around and everything would have been okay. He looked at her again and did a couple additional tests and was on the phone with the cardiologist up here. Took another chest x-ray and noticed that her heart was enlarged. Well, I'd say the first 24 hours were the toughest just because so many things happened so quickly. We went from 1 minute, hours ago, Morgan was a very active, apparently healthy 3-year-old to, that night her getting put on an ECMO machine, which is a heart-lung bypass. And then within 12 hours of us getting here talking about heart transplants. So it was definitely an emotional roller coaster to say the least, especially the first couple days. And then she was put on the Berlin heart, and so from there we just prepared ourselves for trying to get her in the best physical and emotional shape that she could be in for an eventual heart transplant. That's one of the great things about it is it's a bridge to a transplant, and it not only gives her life but gives her the best quality of life that she can get.
This is our situation, and so that just tell her that God's going to bring her a new heart. She understands, even though she's 3.
She's asked how her heart's going to come. Is it going to come in a box, and is Dr. K going to put it in, and who all's going to help, and
she's doing very well, exceeding our expectations, even better than we expected.
I know the Berlin heart received its FDA approval during this process.
Yes.
What's your response to that?
I think it's great. I think it's an advance for children like Morgan, because now we won't have to wait the usual 2 to 3 weeks before we can get the device. We could actually have it on the shelf and then put it in whenever we need to. So I think that could save a few lives and definitely save some time. And
on the Berlin heart for how long?
Close to 6 months, I would say. Yes, so the average time of a patient spends on the Berlin heart is anywhere between 1 month to, say, 75 days. That's the average wait time. 4 weeks to 75 days is a range. This was definitely longer than the usual. So it was because of the antibodies she had developed towards donor hearts, therefore making it hard to match a heart with her. The procedure involves is going back in through the scar tissue, removing the devices that support a heart, putting on the heart-lung machine, taking her heart out with the devices, and then implanting the new heart. We actually got started at about 10:30 and got out of the operating room about 7. So it takes about 2 to 3 hours to control bleeding sometimes in operations like these, and that's what it took. It was, I would say, a couple of hours longer than usual. There was a long wait also at the other end from the receiving end, of the donor end. So typically the way it works is once you sew the heart in, you release the clamp and let blood flow into the heart, and the heart starts beating right away. In Morgan's situation, as quite often in heart transplants, the rhythm wasn't quite exactly as we wanted it. And so then we use temporary pacing wires that are commonly used in heart operations, that are always used in open heart operations, which help get the rhythm that you want. Well, it starts out being a lot of hard work and effort, and when you see something like that work, it's just truly miraculous. It's something that is very gratifying, and I think not a lot of things can feel like that. This is why I think pediatric heart surgery and congenital heart surgery is one of the most gratifying fields.